Imagine this. It's 40,000 years ago inside a limestone cave somewhere in what is now southern France. The fire has burned down to embers, everyone else is asleep, but one man is wide awake and he is in agony. Not the dull ache of a bruise, not hunger, something worse. A white-hot pressure buried deep inside his jaw, throbbing in time with his own heartbeat, radiating up into his skull until it feels like his whole head is on fire from the inside. He presses his palm against his cheek. It does nothing. He grinds his teeth, which only makes it worse. There is no aspirin bottle in a cabinet, no dentist's office, no emergency room 20 minutes away, open all night, waiting for him. There is only the pain and the darkness and the question that every human being before the invention of modern medicine eventually had to face. What do you do when your own body turns against you and there is nowhere to run? Here's the part that should stop you in your tracks. This is not a rare, unlucky scene from prehistory. This is one of the most common forms of suffering in the entire history of our species. Tooth pain has haunted humans for hundreds of thousands of years, long before we had a word for dentist, long before we understood what a nerve even was. And yet, for over 99% of the time humans have existed on this planet, there were no painkillers, no antibiotics, no drills, no anesthesia. So here's the mystery. If ancient people had none of that, how did they survive it? Not just endure it, but actually survive, generation after generation, an affliction that today sends us sprinting to the nearest pharmacy the moment it starts. The lazy answer is, they just suffered. But that answer is wrong, and it sells our ancestors dramatically short. The real answer is stranger, more inventive, and in a few cases so disturbing that when scientists first uncovered the physical evidence, they genuinely didn't believe what they were looking at. Stick with me, because by the end of this, you will never look at a dentist chair the same way again. Let's start with a question you've probably never thought to ask. Did caveman even get cavities? Your gut instinct is probably no way. No candy, no soda, no birthday cake. Surely a diet of raw meat, roots, and berries meant flawless teeth. Here's where things get strange. That assumption is almost completely backwards. Paleontologists digging through ancient jawbones have found something unsettling. Many prehistoric humans had teeth ground down almost to flat stubs, worn away decades before old age should have touched them. Not from sugar, from something far more mundane and far more brutal, their own food. Stone-Age humans were grinding grains, nuts, and dried meat between actual stones, and tiny fragments of that stone, along with grit and sand from the environment, ended up baked directly into every single meal. Every bite was, in a very real sense, laced with sandpaper. Imagine eating sandpaper for breakfast, lunch, and dinner for your entire life. That's not an exaggeration. That's Tuesday 40,000 years ago. Over years, that constant abrasive grinding wore the protective enamel down to nothing, exposing the soft, nerve-packed inner layer of the tooth, called the pulp, to open air, bacteria, and the world. And once that happens, pain isn't a possibility, it's a guarantee. But here's where the story takes its first sharp turn, and it's the twist that changes everything you're about to hear. Roughly 12,000 years ago, something happened that should have made human teeth better. Instead, it made them catastrophically worse. That something was farming. When humans transitioned from hunting and foraging to growing crops like wheat and barley, we assume life got easier. In some ways it did, but archaeologists studying skeletons from this exact transition period found something they weren't expecting. Rates of tooth decay didn't just increase. In some populations, they exploded, sometimes tripling almost overnight in evolutionary terms. Why? Because the invention of the sack of grain was also, accidentally, the invention of the first junk food. Ground grain turns into starch, starch breaks down into sugar, sugar feeds bacteria, and bacteria produce acid that eats straight through enamel. Our ancestors had unknowingly built the perfect breeding ground for cavities thousands of years before anyone had ever tasted a piece of candy. So picture the scale of what we're actually talking about here. Not a handful of unlucky individuals, entire farming villages all across the ancient world, quietly enduring a slow-motion epidemic of rotting teeth with absolutely no idea why it was happening to them and no idea what to do about it. And that's when the real detective story begins, because ancient people did not just sit there and take it. They fought back, and the deeper archaeologists dig, the more it becomes clear that some of these ancient responses were shockingly sophisticated. Let's go back even further than farming, back to the Neanderthals, our closest extinct relatives, the ones history books used to paint as grunting brutes. Here's where the story gets genuinely eerie. At a cave site in Spain called El Cidrón, researchers examined the fossilized dental plaque of Neanderthals who had clearly been suffering from a painful dental abscess and an intestinal illness. Trapped inside that ancient dental plaque, preserved for over 40,000 years, they found microscopic traces of poplar bark. Why does that matter? Poplar bark contains a natural compound called salicylic acid. That name might sound unfamiliar, but you have almost certainly swallowed a version of it. It is the active compound found in aspirin. Let that sink in for a moment. Neanderthals, a species we once dismissed as barely capable of complex thought, appear to have been self-medicating their tooth pain with a natural precursor to modern painkillers, tens of thousands of years before the first pharmacy ever existed. But the twist doesn't stop there. In that same dental plaque, researchers also found traces of a naturally occurring mold, one closely related to the mold that, millions of years later, a scientist named Alexander Fleming would isolate to create the world's first antibiotic, penicillin. So somewhere in that cave, a suffering Neanderthal may have instinctively reached for the ancient equivalent of aspirin and antibiotics at the exact same time. Not from a textbook, not from a doctor, from observation, trial, error, and the desperate and universal drive to make pain stop. That alone should reframe how you think of primitive humans, but it gets even more surprising. Scientists studying the teeth of Neanderthals and other archaic humans have discovered small, repeated grooves worn into certain teeth right at the gum line. For years, this baffled researchers. Then they realized what they were looking at: toothpicks. Ancient humans appear to have been using thin sticks or blades of grass to relieve the pressure and irritation of inflamed, infected gums, digging just deep enough, over and over, to create a physical groove in the tooth itself, a groove that survived tens of thousands of years for us to find. Think about that. Somewhere in the depths of prehistory, an individual in pain discovered that a small stick, worked carefully along the gum line, brought a moment of relief, and it worked well enough that they and the people around them kept doing it for generations until it left a permanent scar in the fossil record. That's not mindless suffering, that's problem solving under pressure, with nothing but sticks and desperation as tools. But here's where things get genuinely strange, because self-medication was only the beginning. What archaeologists found next in the Indus Valley region of what is now Pakistan honestly should not have been possible according to everything we thought we knew. At a site called Mehrgarh, researchers examined 9 ancient human molars, and under the microscope, they found near-perfect cone-shaped holes drilled directly into the teeth. Not cracks, not natural decay, drilled, deliberately, with almost surgical precision. These teeth were 9,000 years old. To put that in perspective, this is roughly 4,000 years before the invention of the wheel, 4,000 years before writing existed anywhere on Earth, and yet somebody in this community had figured out how to bore a clean hole into a living human tooth. How on earth did they do it without modern equipment? The answer connects to a completely different craft, and this is where the story takes one of its wildest turns. The same region, around the same time period, was famous for producing intricately drilled stone beads using a simple but ingenious tool called a bow drill. Picture a small wooden bow, its string wrapped once around a spindle tipped with a sharp flint point. By sawing the bow back and forth, the operator could spin that flint tip at high speed, drilling through hard stone to make jewelry. Researchers now believe that this exact same tool, the beadmaker's bow drill, may have been repurposed and pressed into service on living human teeth. Stop and actually picture that scene. No numbing gel, no sedation. Someone sitting still, willingly, while another person leans in with a spinning flint-tip drill and bores directly into an aching tooth. Why would anyone endure that? Because a rotting, infected tooth is a pressure cooker. The buildup of infection inside the pulp creates agonizing pressure with nowhere to escape. Drilling a small hole releases that pressure, the same basic principle a modern root canal still relies on today. For a few unbearable seconds of drilling, followed by relief that could last for months or years, ancient patients appear to have decided the trade was absolutely worth it. That is not the story of people who simply endured. That is a story of people who invented, thousands of years before anesthesia, a working solution to one of the most painful conditions the human body can produce. But if you think that's the most surprising discovery in ancient dentistry, wait, because the next one is even stranger, and it comes from Slovenia. In 2012, researchers re-examining an ancient jawbone, roughly 6,500 years old, noticed something odd about one of the canine teeth. A large vertical crack ran down through the enamel, the kind of crack that exposes raw nerve tissue and causes genuinely unbearable pain with every sip of water, every breath of cold air, every single bite of food. But packed into that crack, filling it almost perfectly, was a strange yellowish substance. When scientists analyzed it chemically, they identified it as beeswax. Someone, roughly 65 centuries ago, appears to have deliberately packed warm, pliable beeswax into a cracked, screaming in pain tooth, almost certainly to seal off the exposed nerve from air, cold, and pressure. In other words, they invented a dental filling using beeswax, thousands of years before anyone had ever heard the word dentistry. Here's the detail that makes this even more remarkable. Beeswax, at body temperature, softens just enough to mold into the shape of the crack, then firms up again once it cools slightly, creating a surprisingly effective seal. Whoever did this either got extraordinarily lucky, or they had already learned, through trial and error passed down through their community, exactly what worked. At this point, a pattern starts to emerge, and it's worth pausing to really sit with it. Across completely different continents, completely different climates, completely unconnected cultures separated by oceans and millennia, ancient humans independently arrived at strikingly similar answers. Relieve the pressure, seal the wound, numb what you can, remove what you must. But not every ancient culture approached this problem through observation and craftsmanship. Some approached it through fear and through myth. And this next part of the story might be the strangest twist of all, because for thousands of years, much of the ancient world was convinced they knew exactly what caused a toothache. A worm. An actual, literal worm believed to be burrowing through the tooth, chewing away at it from the inside. This idea appears to trace back to ancient Mesopotamia in a text roughly 5,000 years old, sometimes called the Legend of the Worm. In it, the worm complains to the god of the underworld that it is hungry and asks to be given a home inside human teeth and gums where it can feed forever on blood and decay. Now, here's the part that should genuinely shock you. This wasn't a fringe belief that faded quickly. The toothworm myth didn't just survive one civilization. It spread and it persisted, showing up in medical texts across ancient Egypt, across the Roman Empire, across medieval Europe, across China, and it remained a widely accepted medical explanation for tooth decay for roughly 5,000 years, only finally being debunked in the 1700s when scientists with actual microscopes went looking for the worm inside decayed teeth and found nothing there at all. Think about that time span for a moment. 5,000 years is longer than the entire history of writing, longer than the pyramids have existed. An explanation for tooth pain that was quite simply wrong outlived nearly every empire, religion, and language that ever believed it. But here's a curiosity bridge worth pausing on because this myth wasn't stupidity. It was actually a reasonable guess, given what people could see with their own eyes. Cut open a badly decayed tooth, and the soft, blackened, stringy pulp tissue inside genuinely can resemble a pale, wriggling worm to someone without a microscope. The theory was wrong, but it wasn't crazy. It was ancient pattern recognition doing its best with the tools available. And that belief shaped the treatments people reached for. If a worm was eating your tooth, logically you needed to either kill the worm or drive it out. Ancient remedies for this ranged from the surprisingly reasonable to the genuinely bizarre. On the reasonable end, cultures across Asia and the Mediterranean discovered entirely through trial and error that chewing on clove buds provided real, noticeable relief from tooth pain. Modern chemistry later explained exactly why. Cloves contain a compound called eugenol, which acts as a natural anesthetic and mild antiseptic. It genuinely works. In fact, variations of eugenol are still used in some dental products today. Ancient healers had stumbled onto real, functioning pain relief purely through generations of careful observation, with zero understanding of chemistry. On the far less reasonable end, ancient medical texts, including Egypt's famous Ebers papyrus, describe remedies that make you wince for a completely different reason. Pastes made from mixtures that could include onions, honey, incense, and in some recorded remedies across the ancient world, even portions of animal excrement, applied directly to the aching tooth or gum, not because it made scientific sense, but because in a world without germ theory, without any concept of bacteria, sometimes the most repulsive substance available felt like it must be powerful enough to drive out an invading spirit or worm. Here's the emotional undercurrent worth sitting with for a second. Imagine being in so much unbearable pain that you willingly let someone smear that on your face. That is not a story of ignorance. That is a story of desperation and about how far the human mind will travel to escape suffering, reaching for anything, absolutely anything that might make the agony stop. And when nothing else worked, when the pain became truly unbearable, ancient cultures across the world eventually arrived at the same final, brutal solution: extraction. Pull the tooth out entirely. This job, remarkably, often fell not to a specialized doctor, but to whoever in the community happened to have strong hands and the right tools. Blacksmiths, barbers. In some cultures, even the local strongman was recruited, because pulling out a firmly rooted tooth with no anesthesia whatsoever required genuine physical force, sometimes with pliers, forceps, or, in earlier eras, nothing more than fingers, a length of cord, and raw determination. Picture the scene honestly, because it deserves to be pictured honestly. No numbing injection, no sedation, just someone holding you down or asking you to hold perfectly still while someone else wrenches a screaming nerve straight out of your jawbone. The pain of the procedure itself was often described as almost as bad as the toothache it was meant to cure. And yet, people lined up for it, again and again, across every ancient civilization we have records of, because the alternative, living with untreated infection, was so much worse. Here's a fact that reframes the entire stakes of this story, and it's the twist that turns this from a quirky history lesson into something genuinely life or death. In the ancient world, a simple dental abscess was not just painful, it could be a death sentence. Before antibiotics existed, an infection that began in a single decayed tooth had nowhere clean to go. It could spread into the jaw, into the sinuses, into the bloodstream. Sepsis from dental infection was a real documented cause of death for thousands of years, right up until the 20th century. There's a chilling reason dental extraction tools show up buried alongside surgical amputation kits in historical medical collections. Doctors of the era understood, correctly, that sometimes the only way to save a person's life was to physically remove the source of the infection, fast, whatever the cost and pain. So every single one of those ancient interventions we've talked about, the beeswax filling, the flint drill, the poplar bark, the clove paste, wasn't just about comfort. In many cases, it was quite literally a fight for survival, using nothing but observation, courage, and whatever materials happened to be lying around. Now, here's where we step back from the science entirely, because there's a psychological layer to all of this that's just as important as the physical remedies, and it might be the most human part of the whole story. In a world without microscopes, without germ theory, without any concept of bacteria, pain itself needed an explanation, and ancient people almost universally reach for the same kind of answer. Something invisible must be doing this to me. A worm, a curse, an angry spirit, the displeasure of a god. This wasn't foolishness. This was the human brain doing exactly what it's built to do, desperately searching for a cause, because a universe where pain strikes for a reason, even a wrong reason, feels far less terrifying than a universe where pain strikes for no reason at all. Uncertainty itself can be its own form of suffering, and a wrong answer often felt more bearable than no answer whatsoever. And because pain was so often understood as spiritual rather than purely physical, it wasn't just treated with herbs and drills. It was treated with ritual, prayers murmured over the aching jaw, charms tied around the neck, incantations chanted in the dark, sometimes by the very same person mixing the honey and clove paste. Medicine and magic weren't separate categories in the ancient mind. They were often the exact same act performed at the exact same moment by the exact same healer. There's something quietly moving about that, if you really sit with it. Long before anyone understood what a nerve ending actually was, ancient communities had already figured out something modern medicine only rediscovered centuries later. Pain isn't only physical. Fear amplifies it, isolation amplifies it, and the simple presence of another person, someone chanting beside you, someone holding your hand, someone who cares whether you live or die, can genuinely make agony feel more bearable even when nothing about the biology of the pain has changed at all. So let's pull all of these threads together now, because here's the real surprise, the one that's been quietly building underneath every single fact you've just heard. We tend to imagine ancient people as helpless in the face of pain, passively suffering through a brutal existence, waiting for modern civilization to finally rescue them thousands of years later. But that picture is almost entirely wrong. Ancient humans were not passive. They were resourceful, right at the very edge of their available tools and knowledge. They drilled teeth with bow drills borrowed from jewelry making. They filled cracks with beeswax, essentially inventing the dental filling from scratch. They chewed cloves and correctly identified a working anesthetic purely from trial, error, and generations of shared observation. They pulled infected teeth to save their own lives, fully understanding, in their own terms, that infection could kill. They built rituals and community around suffering because they intuitively grasped what modern psychology now confirms with actual data, that connection genuinely eases pain. Every single one of these innovations happened without antibiotics, without anesthesia, without a single university, textbook, or scientific paper to guide them, just human ingenuity, endlessly rediscovering solutions, generation after generation, tribe after tribe, continent after continent, each one solving the exact same excruciating problem in isolation from all the others. And this is where the story turns, quietly, into something bigger than teeth. Because it wasn't until 1846 in a hospital surgical theater in Boston that a dentist named William Morton first publicly demonstrated ether as a surgical anesthetic on a patient having a tumor removed from his neck, a discovery that would go on to transform dentistry along with the rest of medicine. Stop and really absorb that timeline. Humans had been engineering solutions to dental agony for at least 9,000 years, using bow drills and beeswax and tree bark. Painless dentistry, the thing we now take so completely for granted that we complain about waiting 15 extra minutes in the lobby, is barely older than photography. You are living right now in the single most fortunate sliver of human history when it comes to tooth pain, and most of us have never once stopped to consider it. Think about that the next time you feel even a small twinge in your jaw and casually reach for a bottle of ibuprofen, or pick up your phone to book a same-day appointment with a click. What you are holding in your hand, in that ordinary, unremarkable moment, is the end result of hundreds of thousands of human beings refusing to simply accept suffering as the price of being alive. Somewhere in that lineage is a Neanderthal chewing bitter bark in a cave in Spain. Somewhere in it is a person in the Indus Valley, sitting perfectly still while a stranger presses a spinning flint drill into their jaw, choosing seconds of unbearable pain over months of it. Somewhere in it is someone in ancient Slovenia, carefully warming a ball of beeswax between their fingers, pressing it gently into a crack in their own tooth, hoping it would hold. None of them knew our names. None of them could have imagined an anesthetic injection, a filling that hardens in seconds, a root canal completed in under an hour while you scroll on your phone. But every single one of them was reaching toward exactly that future, one small, painful, desperate innovation at a time, without ever knowing if it would work or whether anyone after them would even remember what they had tried. And maybe that's the real lesson buried underneath all of this, the one that has nothing to do with teeth at all. Pain has always been part of being human. It always will be. What separates us across every single era, every continent, every level of technology isn't whether we suffer, it's what we choose to do with that suffering. Ancient humans didn't have painkillers, but they had something arguably more powerful, the sheer stubborn refusal to accept that things simply had to stay the way they were. So the next time your tooth aches, even just a little, remember that you are standing at the very end of an unbroken chain of human beings who refuse to give up, stretching back through beeswax and bow drills and bitter tree bark, all the way into the darkness of a cave 40,000 years ago, where one man lay awake in agony and somehow, against all odds, decided to fight back anyway.